In this question, we have a 1-day-old male seen in the nursery and is delivered vaginally at 40 weeks in an uncomplicated delivery. APGAR scores are 8 and 9 at 1 and 5 minutes. Vitals are within normal limits. An exam shows opening of the urethral meatus on the ventral surface of the penile shaft and 2 bilaterally distended testicles that are normal in size. What is the cause of this infant's abnormalities? A. Failure of urogenital sinus to develop. B. Incomplete closure of the urachus. C. Abnormal positioning of the genitalia tubercle. And D. Incomplete closure of the urethral folds. So I'll let you answer the question, and then I'll explain in 5 seconds. So the answer is going to be D, incomplete closure of the urethral folds. So this is just describing hypospadias. So this is going to be seen on the ventral surface, and it's associated with an increased risk of inguinal hernias and cryptorchidism, which is going to be when the testicle is not distended and it remains in its original place, and that's associated with increased cancer. And so they do like to test about that, and so understanding that there's an increased risk of cancer with this is important. And so the next one is going to be epispadias. So it's going to be kind of the opposite of what we just learned. It's going to be abnormal positioning of the genital tubercle. And then the urethral meatus is on the dorsal surface. Remember that the other one, hypospadias, are on the ventral surface. And so this one, epispadias, are associated with exstrophy of the bladder. And all that means, exstrophy is just the bladder being exposed to outside skin. So the next one is going to be the urogenital sinus. So that's just going to develop into the prostate gland. And then the final one is going to be incomplete closure of the urachus is going to result in a fistula, which just means you can think of it like a bridge. So a bridge between the umbilicus and the bladder. So this presents with an infant having urine coming out of their umbilicus. So that gives you a clue that it could be a fistula. Therefore, it would be an incomplete closure of the urachus. And so just going back here. So for this question, we see a relatively healthy infant, but the biggest thing for this one is just going to be the ventral surface abnormality. And understanding that this is a hypospadia lets you determine the answer, and then you just have to realize what a hypospadia is. And so the definition of it is going to be the incomplete closure of the urethral folds. So I hope that helped, and thanks for watching.